My child isn't talking yet. Should I be concerned? This is one of the most common questions we receive as speech-language pathologists. Parents might be conflicted about confusing information they read online or things that they were told by their doctor. So my name's Kayla, I'm a speech therapist here at T.E.A.M for Kids, and I'll be answering some of the most common questions we get asked for children between the ages of 1 to 4. If you have any concerns with your child's development, it's best to follow your gut and reach out to a speech-language pathologist to schedule an evaluation. The speech therapist will make a skill determination if your child needs speech therapy or not. Early intervention is key. Children's brains are constantly changing and developing as they grow. By age 3, we have 1,000 trillion synaptic brain connections, meaning that our brains can change constantly throughout the day through different life experiences or environmental changes that can happen. So by getting help early on, we can shape those early synaptic connections to promote better development in the future. At home, while you're waiting for a speech evaluation, we encourage you make these small changes to start eliciting more language for your child. So first are environmental modifications. This means putting toys up high on a shelf so that your child has to point or ask for that item, or putting toys in a Tupperware container so they have to ask you to open them to access them. Another way to encourage more language is by describing actions that you do throughout the day. So when you're making a sandwich or doing laundry, describe the steps to your child in a language that they would understand. Next is to provide choices. So instead of offering foods for a snack, you can say, do you want an apple or an orange? That way your child again has to point or verbalize and tell you what they want. Lastly, I would follow your child's lead, especially in play. Jump in and play with what they're playing with, look at what they're looking at, and tell them the language about those things. If their eyes are on it, it's definitely important to be teaching them about that specific item. Because children naturally play and learn about their world and environment through play, playing with your child is a great way to model language and teach new language at home. So I really love farm animals. They're a great way to teach your child how to imitate sounds, how to identify items, how to label items. You can work on prepositions, following directions. You can use these for anything, so I highly suggest you getting animal toys. Another great one is bubbles. Children love bubbles. You can practice popping. They can blow bubbles up high or down low, and it's great for reinforcing when you're trying to teach them a specific topic. Another one is books. Books are really great because you can practice, who's sitting down? She is. So you can practice those pronouns, you can practice labeling and identifying verbs and nouns, and it's a great way to help your child attend to more tasks. Here's a quick guideline of different milestones you can look for between the ages of 1 and 3. By age 1, your child should be using at least 50 words in their vocabulary, be producing one-word phrases, be babbling with varied consonants and vowels, and follow simple commands such as no or come here. By 2 years of age, your child should be using approximately 250 to 300 words, be producing two-word phrases, be producing the consonants B, P, and M, and following one-step commands. By age 3, your child should be using a wide variety of different vocabulary words, be using 3-word or more phrases, producing the sounds T, F, and K, and following 2-step commands. It's important to remember that all children are individuals who learn at their own pace. So if you have concerns about your child meeting these milestones, call us at T.E.A.M for Kids to schedule a speech evaluation.